Welcome to the Deep Dive. We're here to unpack your source material and really get to the heart of the knowledge you need. Today, we're doing a very focused examination. It's about specialized pain management, looking specifically at, a successful model observed in a Long Island chiropractic office. This one's in St. James, New York. Yeah, and our sources, they aren't just clinical reports this time. The framing comes from the observations of a content creator who actually spent time inside Dr. Raymond Semente's practice. So our mission today, let's try to move beyond just the local story and uncover maybe some universal principles here. What does it really take for a modern specialty healthcare practice to blend that cutting-edge tech with a high-touch, really personalized patient experience?
Well, what jumps out immediately from the sources is that this practice's success seems to hinge on a very deliberate synthesis. The creator explicitly noted the environment, described it as a mix of family warmth and cutting-edge technology, which suggests, the environment itself is part of the therapy. It seems engineered to make patients feel their healing is both personal and precise.
Personal and precise. That's an interesting combination.
It is. And that balance, between the emotional side and the, let's say, mechanical side, that's really what we need to dig into here.
All right, let's start with the basics then, the foundation, the reputation. We're talking about Dr. Raymond A. Semente, located in St. James, Suffolk County. And the source material, it's very complimentary, calls him one of the best chiropractors in Long Island, specifically for people dealing with pain from, say, major incidents like car accidents or long-term injuries.
Right. And, in any field, calling someone the best, that can be, it can be just talk.
Sure.
Hyperbole. Exactly. But the sources do offer some evidence to back it up. Apparently, people are traveling, significant distances, coming from all across Suffolk County to his office there on Lake Ave.
That willingness to travel. That's interesting. Why do that?
Well, that's the first critical piece of data, isn't it? Why bypass closer options? It strongly suggests there's established trust, and that trust is likely built on, verifiable, consistent results, especially in those complex cases where maybe general care hasn't worked out.
Yeah.
So that immediately signals specialization. They aren't just competing on being nearby. They're competing on handling complexity and, crucially, on outcomes.
Right. So the specialization itself kind of defines the practice.
Absolutely. It seems Dr. Semente has really built his reputation around one particular advanced method, something that truly differentiates the practice. Which is non-surgical spinal decompression therapy, or NSSD for short.
NSSD. Okay, that sounds like the core focus we need to explore. So let's dive deeper here. For listeners who might not be familiar, how is this method fundamentally different from, say, standard chiropractic adjustments? Or even generalized traction you might find elsewhere?
That's a really important distinction to make. Generalized traction, it typically pulls the body linearly. It stretches muscles, maybe offers some temporary relief. NSSD, on the other hand, it's described as a much more sophisticated, computer-controlled application. It's specifically designed to create negative pressure. Think of it like a vacuum effect, right, within the spinal disc space. That's critical.
Negative pressure.
Yeah.
A vacuum. Okay. Why is that so important?
Well, this negative intradiscal pressure, that's the key physiological mechanism they're aiming for. It's believed to help retract bulging or herniated disc material, pull it back into place, essentially. And maybe even more importantly, it encourages the flow of healing fluids, oxygen, nutrients into the disc. So it's aiming beyond just managing symptoms. It's trying to encourage actual structural repair and promote long-term healing, targeting things like chronic radiculopathy, spinal stenosis, and those really specific, often severe herniated discs.
So it's not just a stronger pull. It's technologically modulated, very specific, aiming for a biomechanical change that maybe general traction can't reliably achieve.
Precisely.
And the conditions you mentioned, spinal stenosis, chronic back pain from accidents, those are often notoriously resistant to conventional care, aren't they?
They are. And the source material actually refers to NSSD as potentially the missing piece when those traditional approaches seem to stall out. When patients kind of hit that wall, they might need a more methodical, technically driven intervention. The sources clearly position the success of this practice as being, tied directly to the reliable application of this advanced NSSD technology.
Okay, this makes sense. To bring this more clinical context to life, the source creator spent some time detailing a specific case, Jeff Niengren, a Long Island resident. Jeff's story seems like a good window into this methodical approach you're describing.
It sounds like it. What did they say about his situation?
Well, Jeff apparently came in struggling significantly with spinal stenosis, severe back issues. He initially started on what the source just calls the general traction table, and that did provide some relief symptomatically.
Yeah.
But the crucial shift, it seems, came after more testing. That led them to transition him specifically to the specialized spinal decompression machine.
Ah, okay. That transition is quite revealing, isn't it?
How so?
Because it helps clarify that potential ambiguity around the equipment. When the source makes a point to distinguish the traction table from the specialized spinal decompression machine, they're illustrating a diagnostic flow. It suggests the latter, the NSSD machine, offers the precise computer-controlled adjustments, targeted angles, specific negative pressure aimed right at the damaged disc level.
Unlike the general pull of a standard traction table.
Exactly. It paints a picture of a practice that uses technology diagnostically. They seem to scale the treatment based on the specific patient's pathology, not just a one-size-fits-all approach.
And the results for Jeff? Well, they were apparently compelling enough for the content creator to really highlight them. Jeff reported feeling so much better after moving to that specialized NSSD machine. So much so that he committed to a full regimen, 20 sessions, and was enthusiastically recommending the treatment and the doctor.
See, that really underscores the value of investing methodically in that specific technology. Seems to validate the approach for certain conditions.
Yeah, it does.
Absolutely. But, as the source creator also keenly observed, just focusing on the technology alone kind of ignores the reality of long-term healing, doesn't it?
Right, there's always the human element.
Precisely. So let's shift our focus a bit now to the operational side, what the source called the necessary human touch.
Okay. The sources do spend some time detailing the supporting staff. They describe them as a professional but genuinely kind group. About 6 people in total. Let's see, he mentions 2 office staff, 1 front desk coordinator, 3 patient care assistants, and also a physical therapist.
Okay, now that team composition, if we analyze it, that reveals a pretty strategic operational decision, I think.
What do you mean?
Well, 3 patient care assistants plus a dedicated physical therapist supporting the doctor. That ratio, that strongly suggests the practice understands the significant time commitment involved in rehab protocols, especially those linked to NSSD.
Because these therapies take time.
Often, yes. They're frequently multi-session protocols. They can be hands-on, require consistent reinforcement, patient education. Their role likely goes way beyond just simple administration. These are probably the people reinforcing the education, managing the routines, ensuring patients are comfortable during those, say, 30 to 45-minute decompression sessions.
And fostering that atmosphere the creator called family warmth.
Exactly. That kind of support system can be crucial for minimizing patient dropout or non-adherence, which is often a huge failure point in complex recovery plans.
So the sources are right then. This team provides that critical human element that even the most advanced machine just can't replicate.
It certainly seems that way based on this description. It's the integration.
Okay, so let's pull back a bit. What are the actionable, maybe generalizable lessons here for a listener, whether they're on Long Island or anywhere else, looking for advanced pain management options? This isn't just about one specific doctor, right? It's an examination of a specialized model.
I think the ultimate takeaway here is really about how we define specialization in modern healthcare, particularly for complex musculoskeletal issues. The success described in the source material for this Long Island practice seems to come down to 3 integrated pillars.
Sure.
First, targeted technology, like the NSSD. Second, a clear diagnostic methodology, meaning they scale treatment based on specific needs, not just throwing everything at everyone. And third, crucially, robust team support. That's the operational heart, the human touch we talked about.
Technology methodology team.
So for you, the listener, if you're seeking highly effective treatment for complex pain, maybe it's spinal stenosis, maybe severe disc issues, the standard perhaps should be set by this kind of integrated model. Look for a practice that invests specifically in the mechanism of healing, like NSSD aims to do, not just generalized modalities.
And ask about the team.
Yes, ask about the team structure. A high staff-to-doctor ratio in a specialty practice like this often indicates a commitment to time-intensive patient care and support, not just quick in-and-out adjustments.
That makes sense. The sources really do make a compelling case that mastering this synergy, integrating the precise science of NSSD with genuine human logistics and compassion, that's the defining feature. That's what allows a practice maybe to stand out in a crowded market.
And achieve those consistent results that make people willing to travel, like you mentioned earlier.
Right. It sets a high bar for what integrated pain management could or maybe should look like.
It does seem to represent a certain standard of care for complex cases.
Okay. Well, for those listeners who might be in the Suffolk County area or maybe traveling to St. James or Smithtown and they want to explore this specific approach further, the sources did provide the final contact details. It looks like the practice can be reached at 631-584-7722 to schedule a consultation.
Good to have that practical info. Now, before we wrap up this deep dive, maybe consider this final thought something to chew on. We've seen here how integrating these high-tech precision tools like non-surgical spinal decompression with, well, fundamental human compassion and teamwork seems to yield superior results, at least according to the source. So when you evaluate your own recovery options, wherever you are, how much weight should you give to the quality of that surrounding team, that human support system, compared to just the cutting-edge capabilities of the technology itself?
That's a tough balance.
It is. What percentage of your potential long-term success might rely on the machine versus the methodology behind its use and the actual hands guiding your rehabilitation journey? Is it 50-50, 70-30? It's something to consider.
Definitely something to ponder as you navigate your healthcare decisions. All right, that's it for this deep dive. We'll talk to you next time.